Good afternoon. Today is May 23rd, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that a small study of patients who were severely ill from the coronavirus hints that treatment with antibodies from recovered patients may modestly help recovery and survival. The study, even though there was uncertain factors, including a weak form of comparison by comparing to similar patients identified through electronic health records, and the results were given in percentages, which and not in the exact number of patients. So it may not be very conclusive and exact, but it is currently the largest study that has been shown to the public that have finished. The death rates were 12.8% among those who got the antibodies, compared with 24.4% among patients who did not get this treatment. The researchers provided this percentages, and that the treatment, which are basically injecting extremely ill patients with antibodies from recovered patients, and the FDA has already approved this treatment for severe cases. So while I think that this study may be inconclusive and it may only shown to help patients a little bit, I think treatments like this is a good way that we can start to help patients, because after all, one treatment is better than nothing, and it's not like showing harm to patients. So I feel like this should be a good course of treatment. The second thing that I'd like to talk about is that dogs in London in UK are being trained to detect the coronavirus in patients even before they show symptoms. So researchers in the UK are conducting extensive trials to see whether trained sniffer dogs can detect the coronavirus in patients, and previously this has been done in people with illnesses like malaria, cancer, and Parkinson's, because they appear to give off a particular odor which the coronavirus patients may also give off. It is done at the London School of Hygiene and Tropical Medicine, and they're collaborating with Durham University and the charity Medical Detection Dogs to carry out the project. They have already received funding, and if this is successful, the sniffer dogs could screen up to 250 people an hour, and they could also play a vital role in detecting the virus in key transportation hubs, including airports and train stations. So when travelers come into countries, the dogs can just sniff out if they have the coronavirus. And even though there may be challenges, this is still a very good idea, because there's already dogs in airports who are sniffing out bombs or explosives. The training process will start with COVID-19 patients asking to wear sterilized nylon socks to collect odor samples and wear face masks for several hours. These patients are all asymptomatic and have tested positive, so that dogs can be trained to sniff out people with the virus even before they know it. And after that, 6 specialist dogs will be trained to sniff out the virus, and the intense dog training will last between 8 to 10 weeks. So if the sock samples doesn't work, then the breath samples can also be done, and by the end of that, we will have a level of understanding of how well the dogs can tell us when somebody's infected correctly. And personally, I think this is an interesting but a really good idea, and I hope the study proves successful. The third thing that I'd like to talk about is that Hertz, a car rental pioneer, has filed for bankruptcy protection. The coronavirus pandemic has devastated Hertz by grounding business travelers and tourists, making it impossible for the company to continue paying its lenders. A sharp drop in used car prices has also decreased the value of its fleet, and I think this is another This is another store chain that has, or economy sector that has been ravaged by the pandemic, and I feel like we're going to, and the pandemic was was like a rapid, sudden, dramatic blow. So I think more of these perhaps car rental sales or companies will also be hit as well, and it truly shows how wide the pandemic has ravaged the economy, like how wide the extent. That's it. Thank you for listening, and I hope you have a good day. Thank you.